Good evening. It's great to be with my church family virtually. We're getting used to that, but I'm not going to get used to it permanently. So we are very excited to be with you tonight, and I hope tonight to share with you just some facts. There's a lot of news out there. There's a lot of misinformation, a lot of contradiction. And not that I'm the expert, but I will follow these things and try to distill that into where we are now and where we're going and what we need to think about that. And so I wanted to share with you tonight a report from the North River Corona Task Force that we've been working closely with the ministry staff here to help educate ourselves and make decisions that are going to help us to be safe and to do things that are wise. And so I wanted to share with you a few things tonight that will, let me see if I can get this to go. It is on. All right.
It's not in presentation mode.
There you go. Don't you just love virtual? So a little update about the task force. The current situation that we are facing right now, not only worldwide, but in the United States, in Georgia, and more importantly, for us in Cobb County, what kind of things are influencing our decisions to do what we're going to do in the near future. And so also to tell you a little bit about the current recommendations, or what I would call prevailing wisdom. So our task force has been meeting for a while: medical, legal, advisory, leadership, professional. We meet on a regular basis. We advise the leadership. We talk with each other. We consult with outside groups, including the CDC, other churches, community leaders, and the health systems that are in Atlanta as well. So it helps us to make our decisions informed, and that's our goal. So what's happening in the world? Well, right now, you know, there's over 7 million cases in the world and 400,000 global deaths. In the United States, we've risen up to almost 2 million cases and over 100,000 deaths. And this is as of this morning. And so each day we see it growing. In the world, we see that the pandemic is still rising. The numbers are still rising worldwide when you add that together. And the area of the world that's being hit the most is the Americas, especially Brazil, and in the South America as well. And of course, the United States continues to have large numbers of the coronavirus as well. The death rate is also increasing. And so in the United States, we've done 22,000 tests, and in those tests, we've had about 22 million tests we have done in the United States. And of those tests, 2 million have been positive, which is about 11% rate. I want to explain that doesn't mean 11% of the people are infected in the United States. It means of those who have been tested, 11% are positive. Many Americans have never been tested because they haven't felt the need to. So we really don't know exactly what the prevalence or the number of people in a community would be. We can only make an educated guess. You see some of the dark states there. Those are some of the states that had the larger numbers of things. This is kind of a shape of the United States with the different states there. Red is not good, and dark blue is really good. And so Georgia, we're kind of right in the middle. Red means that we're seeing more and more cases in those states, and the dark blue, if you will, means we're seeing less and less. So you see we have about 19 or 20 states that are still going up. And the reason they're going up is many times because some of those states are not following the CDC guidelines, and they opened too early and they weren't cautious. Those are things that we need to take into account when we think about what we should do as well. In Georgia, which now we're talking about here at home, about 53,000 confirmed cases. We've had over 2,000 deaths and 8,000 hospitalizations. But the good news in Georgia is that we see the trend going down. when we look at the testing that we've done in Georgia, we've done about 500,000 tests, actually 600,000 tests, with an overall 8% positivity rate. So again, of people tested in Georgia, about 8,000 have been positive. 8% have been positive, 54,000 have been positive. So we look at Cobb County there with the yellow arrow, and we see that Cobb County actually has been kind of in the moderate zone. We haven't had a heavy prevalence of cases, nor have we been in the light zone where we've had very few. We're in the moderate zone. And so that's Cobb County. When you look at what's happening in Cobb County, you see the orange graph there. That's a 7-day average. And then the blue up and down graph is the confirmed cases, and that changes from day to day. Every day that changes. And so, unfortunately, we have a 14-day window where everything to the right of that last line right here is not confirmed because of we need the information from the labs, we need confirmation of the test. But the good news is you can see that in Cobb County we're going down. And that's the thing we're excited about. My own experience in the urgent care centers, and I've worked in several urgent care centers in the WellStar system, is that I'm not seeing very many people come into the urgent care centers who I feel like are positive and who I'm concerned about. And so that has been a very positive change. And so I'd like part of this message to be reassuring as well as cautious. So how can it be prevented? I think, if we were giving a test, I think every single American would pass this test with flying colors. We know how to prevent it. And believe it or not, that hasn't changed. Washing your hands, wearing a mask, distancing, disinfecting services, doing screening questions before you gather as a group, and your interior especially, doing screening tests and doing temperature checks when you gather as a group are a way to prevent infections. And of course, always staying at home if we're sick. Those guidelines have never changed. They are the same that we've learned from the very beginning of this. The interesting fact is that if we had not distanced and not done these things, there is the thought that we would have had 60,000 more positive cases in the United States than we do now. And so it made a big difference. So the CDC still says more than 5 people in your home, less than 5 people, less than 10 people outdoors. Remember, the mask keeps you from spreading the virus to other people. It helps you a little bit, but it really is more keeping you from spreading the virus to other people. The distancing 6 feet apart, unless you're doing some shouting or yelling or singing, or sports, and then they recommend 12 feet. Times of exposure, the longer you're indoors, the more you're going to be exposed. You don't to be exposed to people who are positive. Smaller spaces have higher risks. Wash your hands. They show that washing your hands 5 times a day decreases the risk by 35%. Clean exposed surfaces and don't touch your face. I tried to put a chart together, and I know it was a little confusing, and I apologize, but it was taking all the factors together and trying to help people to make decisions themselves that are informed. And so basically, it goes from no risk, which is virtual, to high risk, which is not distancing, not wearing a mask, having a lot of people inside, more than 5, having a lot of people outside, more than 10, and those things would be at a higher risk. Now, the risk doesn't mean that you're going to get the coronavirus. It depends on who you're with, whether they've been exposed, the community you're in, and many factors. But it just gives you a guide about less risky decisions, more risky decisions. And so this is a little calculator that you can use to help as well. Some facts. We know that 40% of the people can be contagious before they have symptoms. We know that 35% of the people will never have symptoms, and we think that they are less contagious. And the World Health Organization is having a controversy about that right now. Social distancing, I'm sorry, I misquoted, 600 million infections less in the United States. 600. 35 times the number of deaths we would have had we not distanced. So the distancing's been difficult, but it's been valuable. It's been valuable. There are 350 cases of a pediatric disease that we see that's so the children are being effective. Contact tracing, the Georgia Public Health Department is going to be doing contact tracing to help us to reduce our exposure. There's a vaccine that's looking promising, and very excited about that. Not one company, but more than one company has a vaccine that is looking promising, and we hope to have that by January of 2021. Treatment, there is some treatment for the hospital that has been promising. There's been some treatment that there has been no treatment outdoors, outside of the hospital that has been helpful. The hydroxychloroquine and the chloroquine is not thought to be helpful, and if anything, may be detrimental. Testing is available. There are two kinds of tests: the Pcr test, which is the test you would get if you were worried about having the virus, or the antibody test that you would get if you were worried about having been exposed to the virus 3 weeks or longer. The antibody test doesn't mean you're immune, and the antibody test can be false negative if you've been exposed before you develop antibodies. So make sure before you get an antibody test that someone explains that to you so you know exactly what that's telling you. What are we doing at North River? Kind of wrapping it up, is we're not wrapping it up. We're meeting regularly. We're talking about this. We're encouraging all of you to be informed and connected. We're reminding you of everyday prevention. We're monitoring the incidents. We're following the recommendations. We're obeying the law. The governor is going to lift or change some of the guidelines in the next few days. We'll be following the law, federal, state, city, and county. We're making plans thoughtfully and cautiously to lift the restrictions at North River and to begin to start worshiping together. We're still continuing to provide virtual services, being faithful, praying, and getting a lot of advice. And the number one priority is going to be your health and safety. Lastly, just as your brother, as a member, a disciple, a husband, a campus shepherd, a medical professional, I am cautiously optimistic, stealing that from Dr. Fauci. We need to be men and women of faith. We need not to give into extremes, either over anxiousness or caution fatigue, where you get tired of doing the things you ought to do. We need to be patient with each other because each of us have individual life circumstances and individual risk tolerances, and that is part of being in the body of Christ. That's part of our diversity. As a shepherd, I do want to encourage the young folks. I know you feel invincible. I used to feel that way too. It wasn't that long ago. I remember how it felt. But you can be contagious, not know it, and give it to other people. So we need to respect the virus, and we need to respect other people. And thank you so much for the opportunity to share tonight.